Now, this is a really common thing with both breast reductions and breast lifts, and it often gets better, but let me tell you what's going on. When we do breast lifts or breast reductions, we are leaving a chunk of tissue with the nipple attached. And you have to remember that within that tissue is breast tissue, and you have little tubes that are draining the lobules that make breast milk. That's like the functioning part of the breast, and they drain out through the nipple. Now, when we're doing a lift or a reduction, we're removing tissue or sometimes just moving tissue. So we're moving things up, and sometimes just with gravity, when we move things around, some of the tissue will sag a little bit and pull on those ducts, and that will pull the nipple and the areola in. Now, it's really common to see this right after surgery. So you have surgery, and the first couple weeks when you're really swollen and things are pulling this way, the ducts don't really stretch, and so they pull the nipple and areola in. But as the swelling goes down, this usually gets better. Now, unfortunately, it doesn't always get better. So there are some things that you can do. So if it's just a little bit pulled in, sometimes you can just do some minor fat grafting and plump the whole area up. That's probably the simplest solution. If you're having a lot of pulling, especially when you're upright with gravity, your pedicle is probably hanging and needs more support. And so unfortunately, the best solution, if it's really a bothersome problem to you, is to go back to the operating room and try to suture the pedicle up so it stays up and supports those ducts so they're not pulling in. And you can also consider some kind of surgical scaffold, which is an off-label use, of course, to give a little bit more support to the pedicle as well. So yes, it's a very common thing. It almost always gets better on its own as swelling goes down, but there are options if it lasts for a long, long time, like over 6 months.